Dental health is so important for pets because it's a reflection of what's going on underlying as well. So not only do you have problems locally in the mouth when you have plaque and tartar, such as bad breath and gingivitis, dental disease is also a reflection of what else is going on. And it can be linked to cardiac disease as well as liver disease. So it's important to make sure the mouth is taken care of. One of the most often things that I see patients in for related to the mouth are tooth root abscesses, and those are simply a lack of daily brushing.
Most commonly, people will notice the brown appearance on the teeth or even some yellow appearance on the teeth. Bad breath, obviously, is a big one. With progression of dental disease, we can notice kind of food aversion, aversion toward hard kibble. Sometimes you'll notice dropping of food. Even sometimes you might notice pawing at the face.
So when I'm treating periodontal disease and doing a full scaling and polishing, it is something that's done under anesthesia for the safety of not only the patient, but us as well. What we do first is we do charting, so we look at every individual tooth to see where the problems might lie. And then we do full dental mouth x-rays as well, and that tells me what's going on beneath the gum line. So if there looks like anything of a start of an abscess beneath a tooth, then I might want to address that issue. If we look like there's an abscess that's forming beneath the surface, then yes, that tooth likely needs to come out. A lot of teeth in more advanced stage periodontal disease are actually very, very loose and are on their way out anyway, so those teeth would need to be extracted, but it is a decision that's made on each individual patient's basis.
The best thing that they can do at home is going to be brushing the pet's teeth as often as possible. I mean, once a day would be the ideal. I know that's easier said than done, but that's probably the best thing we can do at home to help prevent progression. The other thing would be encouraging water consumption after meals. So we're trying to eliminate that food sticking and staying on the teeth.
So every year I do recommend having your patient brought in for a tooth and gum check to evaluate for any periodontal disease. If you are noticing problems in between, if you're noticing bad breath, if you're noticing swellings around the mouth, if you're noticing loose teeth, bring them in before that. Certainly we want to address those issues and not let those wait, but on your annual visit, it's a good idea to always have the mouth looked at.